life brought to a standstill, bustling cities put on lockdown, global economy on its knees. It's been called the worst public health crisis for a generation, the coronavirus pandemic. From Voice of America's World Headquarters in Washington, I'm Sara Zaman. Welcome to a virtual town hall. Coronavirus, global experts answer your questions. What started as a mystery illness in one Chinese city last December has now spread to at least 150 countries. Around the globe, over 225,000 people have been infected, and close to 10,000 have died. While China has managed to reduce new infections, large parts of Asia and Europe are seeing a rise in new cases and deaths. Iran and Italy are major hotspots. As the COVID-19 infection has spread across the globe, so has misinformation. So today, we'll try to separate facts from fiction. My guests are Dr. Tom Frieden, former director of the U.S. Centers for Disease Control and Prevention, commonly known as the CDC. Dr. Kamyar Alai, co-president of the Institute of International Health and Education in Albany, New York. Dr. Ingrid Katz, assistant professor at Harvard Medical School. Professor Jason Farley from the Division of Infectious Diseases, AIDS Service, and at Johns Hopkins School of Medicine. And also I'm joined by Dr. Chang Chuan Chan, Dean at College of Public Health, National Taiwan University. I want to thank all of our guests for joining us. In the interest of social distancing, all the guests are participating from separate locations. We don't have a studio audience either for this town hall, but we have received your questions from around the globe, and they will be part of our conversation today. So let's get started. Dr. Frieden, I want to start with you. What's your overall assessment of the situation as it is at the moment?
It is different in different parts of the world. Where I am in New York City, unfortunately, we seem to be in a rapid acceleration mode of the pandemic. In China, they've tamped down cases. In Africa, we're waiting and concerned that there may be an increase. But everywhere, there are things that everyone can do. For individuals, for healthcare systems, for governments, and especially for people who are medically vulnerable. We're most concerned right now about healthcare workers and healthcare systems. What we're seeing in Italy is just horrifying with the number of healthcare workers who have been infected, and we're very concerned that could happen elsewhere. Healthcare workers are our most precious resource. They are on the front lines of this battle. We need them to be safe. We need them to be able to care for patients safely, and that's something that is urgent everywhere in the world.
So we're relying on healthcare workers to protect us from this crisis, and they themselves seem to be in a crisis. Dr. Katz, it's been roughly 2 months since we have been actively facing this epidemic, this pandemic across the globe. Do you feel we're in a better position in any way? Because as Dr. Frieden said, the situation is different in different parts of the world. But are we better off in terms of our knowledge, in terms of our strategy from where we were a couple of months ago?
So I think that's really a critical question. And I think it is a bit of a mixed picture right now in the sense that we do have a lot more information than we had 2 months ago in terms of the spread, the transmission, and certainly understanding what this virus is. And certainly there's accelerated work around vaccine development and possible treatments. But in many ways, we've been set back by the lack of testing, certainly in this country and in other regions of the world, as Dr. Frieden was noting. And so in many ways, we're in a worst case scenario for certain parts of this globe. And certainly there are many countries that we are waiting with anticipation to see how they're going to respond to this.
Mm-hmm. Dr. Chan, I want to come to you. Along with, China has been able to bring down the numbers, but Taiwan has been hailed as a success story as well. It's located very close to China, roughly about 130 kilometers, and out of a population of about 23 million people, so far you have around 100 cases. What has worked? What can we learn from Taiwan's experience?
We are the wonderful country has this harsh relations from SARS 2003. So since then, the whole society is very wary of these newly emergent diseases. So over the 17 years in the past, we have been building and building our system and be ready for infectious control. And one lesson we learned from SARS is that you never can expect timely and correct data from China. So you got to be very cautious from the beginning. Once there's a small number of reports, and you got to take actions and very quickly. So one of the many things we kind of successfully contained this epidemic to around 100 cases in Taiwan is we have this early screening back in the beginning of January, and later we banned the travelers from Wuhan, then all of China. So this is very important considering our large volume of trade and travelers every year between Taiwan and China. This is quite amazing. So this is, I think, most important act earlier and quicker. And even though there's a couple of reports that could mean something serious.
So early screening and travel ban initially really helped Taiwan keep the cases under control. One thing that you mentioned, Dr. Chan, was that Taiwan learned from the SARS epidemic. Dr. Farley, I want to bring you into this conversation. We're seeing a lot of comparison also from other epidemics, flu being one of those. I mean, in the US, just within this flu season, about 18,000 people have been killed. And I want to bring in a question from one of our audience members. Miraz Tolijanov from LA is asking, there are a lot of infections with a higher mortality rate, but there's so much concern about the coronavirus. Why so?
Well, I think it's important that we understand the math here. When we're talking about case fatality rates, or as your guest mentioned, mortality rates, we need to understand the differences at play between influenza and that number of 18,000 and what the denominator of the total number of people who've become sick with influenza is. So when you look at that 18,000 compared to that denominator of the total people with flu-like symptoms, flu-like illness, as well as the modeling that goes on based on the number of cases we expect around the world and in the United States, we know that that mortality, case fatality rate is approximately 0.1% with seasonal flu. When we look at what our current estimates are, and they are different depending on the amount of testing that has been done in each country. The WHO is now reporting, between 2 and 3% is the mortality rate. I've seen estimates as high as 3.4. We've also heard Dr. Fauci state that he believes our modeling will wind up having a mortality rate around 1%. Now, if you look at 1 versus 0.1 for influenza, that is an order of magnitude difference. And that's why we're so concerned with the coronavirus compared to seasonal flu. The second point is that we also have adequate both vaccines that attenuate infection for influenza. We also have adequate treatments with neuraminidase inhibitors such as Tamiflu that we can use for the treatment of influenza that helps mitigate and shorten the time of disease. We do not have any of those options, although they're under evaluation. We got bad news yesterday about lopinavir, ritonavir from the New England Journal of Medicine that was ineffective. We don't have other treatment options right now for coronavirus, although many are in evaluation stages right now.
Dr. Kamyar, from Taiwan's experience, we can learn what to do. Let's look at Iran. Iran is in a situation that many other countries are also now facing. The cases have been consistently going up. What can we learn from Iran and other countries that are consistently seeing a spike in cases in terms of what not to do or what to do differently?
So that's a very good question, and this is a good case when you politicize non-political issues like, health concern. Unfortunately, if we look at the media over the past 2 months, initially we asked the government of Iran to close the direct flights from China to Iran. But unfortunately, due to political interest, not only they didn't close those flights, in some occasions they increased number of flights because some of Chinese, they couldn't make to their final destination to Turkey or Dubai. They ended up using Iran. And also there were two political events. One of them was the anniversary of the revolution. And after that, we had the parliament election. So the government didn't want to admit that they are at risk for coronavirus because they didn't want to discourage people to come to participate to those events. Particularly, we had a demonstration 4 months ago that there were a lot of people came to the streets against the government. So during those political interests, Iran, they try to undermine the significance of coronavirus. And finally, 2 days before the day of election, they admitted that they had 2 cases, which were 2 death cases. While we were expecting that you have some detected cases, out of them maybe 1 or 2% they may die. That showed that even they identified some of those infected cases, but they didn't want to admit that. And after that, because the first location was Qom, which was a religious place and very political city, so while the Ministry of Health recommended to put that city in quarantine, the government didn't accept that. And the militia was informed in those decision-making process, which resulted in that they misinformed the general population and particularly healthcare workers. So the healthcare workers, they were not prepared to protect themselves. Mm-hmm. You see, there are a lot of doctors and nurses, they got infected and they died. More than 25 doctors and nurses, they died. Mm-hmm. And that was the result, that there is no clear decision making. There was a discrepancy among experts and policymakers, and this is what we see today, that Iran, I think, has a lot of infected cases. Why they report around 19,000 infected, but I believe it's 5 times more, mm-hmm. because they have very limited a case funding, and is more concentrated among hospitals.
So lack of transparency seems to be a big problem, and that's also not a problem that's unique to just Iran. That's a problem in a lot of different countries. Dr. Katz, who should the public be listening to? Because people are relying on government for strategy, and there is also a concern that governments may not be telling their own people the truth. Who should people be listening to?
So I think that's a great question, and I think you're absolutely right that there is a lot of misinformation currently, both coming out of various sources around the world and certainly online. I think a lot of people access their information online. And I think we really want to be honing into the experts and really trusted news sources. This is a time for that now more than ever. And I think we absolutely want to be listening to people who have spent a lot of their career thinking about how to control pandemics, certainly people who are trained in infectious diseases, and other people who are working with well-respected organizations and media that has long-term respect around the world. So certainly Voice of America is a trusted source, and certainly there are other news sources out there that are much more reliable that we should be listening to.
Right, that's what we are trying at Voice of America to do, constantly bring people updated and accurate information. I want to bring in a couple of more questions that we're getting for this global town hall. Abebehu Kasa and Sirapa Yotore from Ethiopia and Edward Gelimulin from Moscow. They all want to know, can a person who recovered from COVID-19 catch the virus again? Does the virus develop resistance after recovery? Dr. Chan, if you can take that question, please.
It's too premature to say that. At least based in our cases in Taiwan, we didn't see that. Mm-hmm. So that should not be main concerns to me. Yeah.
All right. So there's sporadic information, but we can't say yes or no clearly in terms of whether the virus could infect the same person a second time. Another question. Hafsat Waziri has asked, the very first person to have been infected with this disease, is there any indication of exactly how they got infected? And Shehu Adamu Rijau has also asked that, to begin with, how exactly did this disease come to be? Now, Dr. Katz, we know that this disease started in China and that it has come from animals to human beings. What more do we need to know, and how important is it to right now know how it started, given that we're about almost 3 months into this epidemic?
So that's a great question from your audience member. And I would say that right now, what we're clearly focused on is human-to-human transmission, and that's really the impact that we're seeing globally. I think for people who think a lot about pandemics and think about how these transmissions occur, it's absolutely important to trace back to the original source so that we know for future pandemics how to potentially prevent those sources of transmission. But in this moment, we are absolutely focused on human-to-human transmission because that's absolutely where most of the transmissions are occurring.
Mm-hmm. Dr. Alay, I want to bring you back into this conversation because all of you are talking to me on Skype, so you can't really see each other. But that's the joy, that's the upside of having this virtual town hall, that all of us are connected and we can all talk to each other. So in terms of, we talked about the lack of transparency from the government side, but let's also talk about public behavior. we're seeing even in the United States that not everybody is heeding government warnings. They're being asked to follow social distancing guidelines. People are not doing that. How much responsibility right now is on the public's shoulder when it comes to preventing the spread of this pandemic even further?
So that's a very great question. For example, if we look at the case of Iran and maybe in case of United States, in the earliest stages, there was a kind of lack of transparency and a timely awareness about the significance of disease. For example, in case of Iran, early they tried to undermine the significance of coronavirus by comparing that with influenza. And that tried to misinform people. So that was the reason, and that was the foundation that a lot of people, they didn't believe that this is an important issue. And I think this is the case in the US, as you know. For several weeks, they didn't take it seriously, and that was the reason that a lot of people still today, they don't believe that it's serious issues. And definitely, if we don't have a public engagement, and especially, the community are not engaged, we can't control disease. For example, even today in Iran, there is a study while 90% of people, they know about coronavirus, 60% of them, particularly those who are under age of 60, they don't believe that they are at risk, and even they get infected, they don't die. But if we see the reports from France, there are a lot of people under age of 50, they may die. So it's a kind of unfortunate delay in response by the government, and also undermining initially the significance of disease. And this is the result, how we can bring back the trust of people and make it more important. I think the only way is to do more education and give more transparent results and show that is not only a particular part of population who are more vulnerable, and everybody may be also, not only they may die, but they may transmit to those who are at risk and they may have chronic conditions.
Mm-hmm. Dr. Farley, what's your take on this? Because you have also worked on the HIV epidemic. So in terms of convincing people to follow guidelines, what would you suggest?
Well, first and foremost, we need to recognize that changing human behavior is a challenging endeavor. That's first and foremost. So we're asking people to fundamentally shift and change their lives, and doing so in an environment in which the public is receiving mixed messaging. Right before coming on this call today, we saw a New York Times reporting from the CDC that shows that we are seeing a substantial number of cases. Approximately 40% of hospital admissions in the United States fall below the age of 50. So we do need the public to recognize and realize that while you are at lower risk when you are below 60, with each decade lower risk, people with comorbidities and underlying conditions, immunosuppressed patients for any reason, are at increased risk of complications from this infection. The data out of China published in the New England Journal of Medicine also showed that a fairly large number of children less than 10 years of age, although there was not mortality associated with it, there was some significant morbidity associated with their disease. Pneumonia was found on chest X-ray in multiple cases. If memory serves correct, approximately 32% of cases had pneumonia found on X-ray when a child was under the age of 10. So it is something that we definitely need to be paying close attention to regardless of age.
And it's very important, as you mentioned, that roughly 40% of people in the U.S. who have been admitted to the hospitals are between the ages of 20 and 54. And I want to bring in another little piece of research for our audience, that a U.S. study has also found that the coronavirus that causes COVID-19 can last in the air for up to 3 hours, up to 4 hours on copper, 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. So a lot of surfaces can be contaminated. And one question that a lot of people are asking, Dmitry from Ukraine has also asked on our social media platforms, do masks help in preventing coronavirus? Dr. Chan.
Yes, this mask wearing it's become a kind of vaccines in Taiwan. Everybody is wearing that everywhere. And so it's contradictory to the general perceptions or general recommendations from different agencies saying that only people are sick need to wear a mask, and medical personnel are priority of wearing the respirators preferably. But in Taiwan, we thought that it's very important barriers for people who are in the crowded indoors to have this mask to keep social distance enough that our physical distance cannot allow. And on top of that, this COVID-19, we saw very clear evidence that without symptoms, and people can be transmitting the virus to the other persons. So on that occasions, that if the general population can wear mask, it's kind of a coverage as a vaccinations to us. So there's also a very good side effects or butterfly effects of wearing masks. We saw that seasonal flu also went down because of this kind of practice.
So in a way, it serves as a visual reminder that when you see people wearing a mask, it reminds you that there's a serious situation going around and maybe you should pay attention to it. But Dr. Farley, in the US, we're also seeing, and even the CDC has said that you should wear a mask if you're unwell, if you're feeling sick. But if you're all right, you don't need to wear it unless you're caring for somebody who has COVID-19. So in terms of that, there's also been, people have freaked out. People are going out and trying to buy masks, and there are shortages in different countries. Have we reached a point where everybody around the world should really be focusing on masks, or should this guideline help people understand that it's not the first thing they need to go out and be looking for?
So the short answer is no. I do not believe that the general public needs to be wearing either a paper mask and certainly not an N95. First, on the N95 issue, we are experiencing shortages. Healthcare workers and individuals caring for people with COVID-19 do need access to these N95s. Second, healthcare workers are fit tested, so we know exactly how our face fits with a specific mask. It is something that must be completed in order for that mask to be effective. Third, I have seen personally people walking around with N95s with major gaps, for example, under the mask. They're being used inappropriately, and the public is using a scarce resource in inappropriate ways. Now, with regards to a paper mask, that has been shown. We know in tuberculosis, putting a patient in a paper mask reduces infectivity for those around them by 50%. And that's been in some aerosolized studies completed in South Africa and other parts of the world. With COVID, we would know that a paper mask would also stop the droplet nuclei from being transmitted. And so we do believe that a paper mask, if you're symptomatic, will help reduce infectivity and transmissibility to people around you. And so we do recommend you mask up if you are sick. In terms of the ability of a paper mask, however, to prevent your eyes and other mucous membranes from being exposed, it does not. So if you are out in public and you are wearing a paper mask and you're not symptomatic, and you still rub your eyes or touch your face or don't wash your hands in between, removal of the mask to eat, you will still get infected with this virus. It provides no prevention in that regard.
All right. I want to move now to a video question that we've received from Pakistan, and it's a very interesting question because it involves not only living, breathing people, but also people who may have passed away of coronavirus. Let's take a look at that question.
Recently, a video went viral on social media in which a young man was pleading for help to bury his sister, who has died of coronavirus, but nobody is coming to help him. I want to know whether a dead person who is not breathing is as dangerous as all of us who are breathing, because so far we know the virus spreads from breathing and touching.
So we heard the question, Dr. Katz. If you could answer that question, please. Can the virus also be transmitted from a dead person?
Yeah, so that's a great question, and one that I think we're still trying to discern. I mean, I think that there's no question that contact is a huge mode of transmission. And so, again, if someone were to be in contact with someone who has unfortunately passed away from COVID, I think there's no question that they should be wearing gloves. And I think the question of aerosolization of the virus, I think, is less certain when someone has passed away. And I think that these are very difficult decisions to make for families as people do pass away. And I think having as many possible layers of precautions is probably wise. But I think at this point, what we can say for certain is contact precautions still would be advisable. In other words, putting on gloves on your hands. And then, as the last speaker was just saying, the important thing about wearing gloves is that you then don't touch your face. Because if you're wearing gloves and then you rub your eyes, it's as if you weren't wearing gloves at all. So gloves are a useful barrier as long as we remember not to touch our face after we've come into contact with a surface or a person who may have COVID.
All right. Dr. Kamyar, I want to have you answer this question. Baba Abdullahi Maska from Chad has asked, what's the difference between coronavirus and the common cold? And I also want to add a second part to that question. What are not the symptoms of coronavirus?
So that's a good question because, we have a general coronavirus that, make a lot of, common cold. But the significant is this one, like its family members, like SARS and MERS, is that while they were transmitting among animals, there were some mutations that they were transmittable to humans. And that was the reason we had SARS in 2002, 2003, and MERS in 2012, and now we have this type of coronavirus. There are some symptoms. It's not very significant because they may have some overlap, but usually this type of coronavirus is affecting lower respiratory system, which is they have more fever and dry cough and dyspnea, rather than just common cold that they started with affecting upper respiratory system, like, have rhinorrhea and have a kind of malaise, but less likely they have a consistent dry cough. And also, these are some kind of, they may have extra respiratory system like diarrhea that this type of coronavirus usually they don't have. But the point is that it depends of the immune system of the body that who got affected. They may have other symptoms that they are not very specific. But the key point for us is that the process of the disease, if they are deteriorating, because usually the common cold, they don't get deteriorated. So they may have some mild symptoms and they get better over the time. But among this type of coronavirus, the situation why in 81% it's just we limited to mild symptoms, but in like over than 15% they get worse. And this is the time that we may be more cautious that we may get coronavirus.
So since there is no vaccine yet, and there's also no direct treatment of COVID-19, when a person goes to the hospital, what kind of treatment can they expect to get? Dr. Farley.
Sure. I think first and foremost is, when we're looking at three cardinal symptoms right now, cough, fever, and shortness of breath, we're screening for those three cardinal symptoms that we're really looking for that, as was mentioned, a dry cough, that runny nose, sneezing, kind of allergy season symptoms are not consistent typically with what we're seeing, at least right now in the United States. Obviously shortness of breath and worsening difficulty breathing with exertion are symptoms that someone may be moving into a pneumonia or other worsening acute respiratory symptoms. But once we have symptoms consistent with the need to screen, most institutions in the United States are ordering evaluations for COVID. We're ordering evaluations for influenza, both virus types A and B, as well as RSV. I spent Monday screening healthcare workers within our health system to determine whether or not we needed to screen. And the first thing we do is, if necessary, order these tests. When they come into the facility for that test, they will be getting what we call a nasopharyngeal aspirate or swab. That is a cotton swab that goes inside the nose, approximately this deep into the nose. It is swabbed, and then we send that result, that swab, for viral culture and PCR-based testing, which is a rapid type of test. But because of volume, it's taking, in some health systems, more time than we would normally expect, 2 to 3 days to get those results. If a patient has acute respiratory symptoms to the point where they need oxygen or need a potential for imaging or or potentially, depending on how bad those symptoms occur, mechanical ventilation, then obviously those patients are being admitted to the hospital under observation, possibly into an intensive care unit bed. And based on their symptoms, their oxygen demand, how well they're able to oxygenate their body, they may be ventilated and receive supportive measures to support making sure that they don't progress as best as possible. Right now, in terms of treatments, if it's influenza, clearly we're treating the flu as we would normally treat influenza. There are emerging possible options for treatment, and there's a long list of them, and many health facilities across the country are evaluating what might work most effectively for each patient. Right now, most patients are receiving symptom management.
All right. Dr. Chan, Greg Frolov from Kiev, Ukraine has asked us this question. They want to know, what's the expected length of quarantine? And I know in the U.S. we have heard 14 days. But I've also seen interviews of people who said they had been quarantined for more than 20 days. So what's the average length, and how long are patients in Taiwan being quarantined for?
Yeah, the reason we can keep our cases low is we have a very furious and comprehensive finding cases, isolate them if needed, and quarantine some of them. So, that's we practice as 14 days. As our rule. So every day we have a house calls, and we check people's compliance and make sure they are following the rules as we did and before. So this is assistant work by public health nurses, and you got to have some of the civil servants in the local districts, and they are working with this person under investigation or confirmed cases to do this kind of quarantine at home. Mm-hmm. So 14 days is ours rules, and some of them will be tested. And if some of them are not tested, or we will see whether they check the temperatures and observing whether they have symptoms. So 14 days.
14 days. All right.
Yeah.
Dr. Alay, what should a quarantine facility look like? Because we've been receiving complaints from our viewers in Pakistan who have come from Iran. They were quarantined in the border area, but they're complaining that there's a lot of just free movement. So what should people expect from a quarantine facility?
So it depends on the country, because unfortunately still in Iran, still today, they don't really implement quarantine. And that's the challenge that we have, that there are a lot of people moving around, especially today is the Persian New Year, that a lot of people are traveling like as we had 2 months ago in China, that it was during the New Year celebration, and that was one of the reasons people moving around. And that's the case for those who go back to Pakistan. In the border, there's not a clear screening. For example, today there was a report even from Afghanistan that they say, how come there are 40,000 people from Iran came back to Afghanistan and only 23 of them they got positive? That shows that they are not really do a screening. And when we say about quarantine, which they should go and stay in their home for 2 weeks, and we have to have direct observation. For example, in India, so when they put those people in quarantine, there were some people even waiting outside. First, to make sure they are implementing, and second, provide some immediate needs, because some of these people, if we just ask them to stay at home, and if they are over age of 60, so they need some kind of facilities to provide food or other immediate needs. So the point is that we have to implement it really, and also provide those needs that those people are in need.
Because especially it's a tricky situation for travelers, people who have been stopped at borders, who are being held in quarantine facilities on the borders. It's a very tricky situation for them. Dr. Katz, I want to bring the next question to you. Yandakan Das has asked if it's true whether Black people are immune to the coronavirus. And it's an interesting question because we thought young people couldn't get it, but now we're seeing young people are getting it. A newborn in London was tested positive. So age and race, do we know what role they play?
So there's no indication at this point to assume that any racial ethnicity is immune to this virus. Certainly, there have been already reports of cases on the continent of Africa, and so there's no reason to suspect that someone of African or African American history or race would be immune to this. I think it's clear, as was previously stated, that there are rates of transmission that come from people who have no or low symptoms. And so, given that we have had very low rates of testing in this country, it's hard to know the denominator. And I think that's the most critical piece I want to convey to your audience right now is I've made the analogy that we're steering a ship and we see a very small sliver of the tip of the iceberg, but we have no idea what's underneath the water.
Mm-hmm. And also,
and until we have widespread testing, go ahead.
The other issue that's also posing a lot of problem is people who look healthy, people who are not showing symptoms, and they still might have it. How much does that complicate the situation? Dr. Katz, if you could do that, take that question, please.
Yeah, it absolutely complicates that question. And I think that's one of the biggest challenges we face. SARS and Ebola are other massive outbreaks that have been discussed in this context. And I think the difference there is that they were both highly symptomatic very early on. Whereas with COVID, it seems to be clear that there is a period after infectivity where people may have no or low levels of symptoms and absolutely still could transmit the virus. And so that's a huge issue in terms of containment.
Mm-hmm. Let's bring in another video question that's also from Pakistan. And this time the question is about animal and human contact. Let's take a look.
People have been asked not to shake hands, to wear a mask and use sanitizers. But is it only human contact that's risky? Or do pets pose a risk too? Also, is animal-to-animal contact a problem? What can we do to protect pets at home?
Dr. Farley, if you could take that question, please.
Sure. So household pets, we have data that suggests that they are not carriers of coronavirus and they're not infected. Now, that said, this is a zoonotic infection. We do know, or we believe that this was a infection that began and its origins were in animals, and then that actually mutated and moved over into the human host. And so with that in mind, animals can get infected with the virus. Of course, they can. But what we've seen in the United States is that animals and their pet, and their owners are not transmitting virus back and forth to one another.
Mm-hmm. Dr. Chan, via Instagram, we've received this question from ArtGold75 from Minsk, Belarus. And they have asked, besides hygiene, how can you help prevent the virus? Any special nutrition or medicine? And that's an important question because on a lot of social media platforms, WhatsApp and Instagram, we're seeing a lot of advice, eat garlic, use aloe vera and all of these things. And I understand that garlic may help in social distancing. You may not want to talk to somebody with garlic breath. But in reality, do we know if any kind of diet or herbs can help with the situation?
Yeah, every time we have this kind of newly emergent diseases, and there's always this kind of traditional ways of medicines or nutrients claimed to be effective in Taiwan and in Chinese society. I think there's a lot of such kind of claims, and but none of them has been seriously studied and under a randomized controlled trial to prove it. But if you don't have anything to treat people, and people will try to find their way to make them feel better or be stronger, that's most of them. I don't think this is true.
So far, there is no proven magic potion that you can make at home or buy from someone that's going to help you with this situation. There's also a lot of conversation going on social media platforms about self-tests. Hold your breath. If you can't hold it for 10 seconds, that means you have the coronavirus, and these kind of self-tests. Dr. Alay, is there any evidence? Is there any support is there any proof that these kind of home self-tests can direct you in the right direction?
Unfortunately not, because the challenge is, as other colleagues mentioned, more than 81% of these people, they have mild symptoms, or they may be in early stage asymptomatics. And the challenge is that if you have a kind of misunderstanding that maybe you just do some kind of self-testing that you are not infected, you may be careless and easily transmit that to your family members, because 85% of those transmission is from homes that they can transmit to their family members or friends. So I don't recommend that we use those as a evidence that we say whether I am at risk or not. And we should just look at those, general, precautions, general, education comes from, like CDC, NIH, or, universities. And this kind of self-testing also, there are some reports that there are some spams. They want to get your data. So we have to be very careful about those things.
That's a very interesting point, that somebody just might be trying to get personal information about you. Dr. Katz, Tamara Melanik from Switzerland wants to know how we can prevent such exponential growth of the infection in the future, and does this pandemic call for a review of international travel regulations? What does the future look like?
So that's a great question, and I think we've had to really revamp how we think about so many aspects of our lives. And I think that this is something that people who think about pandemics a lot have been raising now for a while. And I think in this case scenario where you have very high rates of transmissibility, you have an infection that may be transmitted, is certainly transmitted when someone is asymptomatic, and then you combine that with global travel, you have a pandemic on your hands. And I think we're clearly seeing that play out. I think we need to be thinking much more constructively about ways that we can stay interconnected while still remaining separate from one another. And certainly right now, there's no question that social isolation is absolutely key to trying to break the path here in terms of transmissibility.
But Dr. Katz, could that be the new normal? Should we consistently now just plan on having some kind of social distancing every season, every year?
Well, so I think that that's a great question. And I would hesitate to say that this is the new normal, because we're obviously seeing this play out real time. And so I think we have to be prepared that there may be longer periods than we had hoped in terms of the need for social distancing. And then I think we need to be mindful about how our global travel is impacting each other and how viruses can be spread. And I think there's a lot that we can be learning in this moment about ways that we can stay connected to each other and continue to communicate while maintaining that level of social distancing from each other.
All right, Dr.
So a lot is to be learned.
Dr. Farley, Deslin Fayisa from Ethiopia wants to know if weather conditions affect the spread of coronavirus. And that's a question a lot of other people have too, that will temperature changes change the course of this pandemic?
So the easy answer is no. When you look right now, the southern hemisphere of the globe right now is moving into early fall as we're moving into early spring here in the north. We are seeing cases throughout the world, regardless of temperature, along the equator. We're seeing places in the middle of summer experience cases. But the difference in seasonality is that when the weather is warmer outside, we spread more as a human species. We are more outdoors. We are more socially distant during the summer and warmer months of the year. And so where I do see the potential for a seasonal effect is the fact that we will have, just by the nature of how much more we interact with nature and the outdoor activities, have a greater amount of social distancing. Now, you will have seen many media reports that show very crowded beaches over the U.S. spring break, and that is not our idea of being outdoors and social distancing. Being in large masses of people, whether you're outdoors or not, is the exact opposite of social distancing, even if you're on the beach.
All right. Dr. Alay, we have this question from Ukraine. Sabrina Trosh has asked this. Is it true that people with two blood types catch virus faster and with more intensity? I know we've talked about age and we've talked about race. What about blood types?
So, upon my knowledge, I don't saw a significant study about that, particularly about this, type of virus. Definitely, different blood type may have some impact, but generally speaking, upon my knowledge, I haven't heard about that.
All right. And also, Eugene Jaroslavsky from Odessa has asked, are there any projections of how the situation will evolve in the near future? And I just want to add to this, can we expect all of this to come back next year, Dr. Katz?
So I think that this is all being discerned real time, and there's no question that we can learn quite a bit from countries where they have managed to bend and flatten the curve. Certainly, as our guest is saying, in Taiwan, they've had great success. South Korea, in China, they just announced that they have not had a new case endemically. And so I think that there are a lot of lessons here. I think best case scenario, if we have the strictest of isolation measures in this country, we are talking at least a couple months based upon what we're seeing in China. But again, if those measures aren't attained, this is going to continue to evolve. And I'm talking about just in the United States. This is going to continue to evolve throughout the world globally. And I don't predict that it will end until we have a very effective vaccine that we can disseminate widely.
Mm-hmm. And I want to talk about vaccine, but before that, Dr. Chen, I want to ask you, Taiwan has been hailed as a success story, but we also saw that despite maintaining a very, very small case load, when people started coming back from their travel overseas, the cases started to rise. How concerned is Taiwan that the tide could still turn against them and the gains that have been made could be lost? And I also want you to address China in this situation, because China is also bringing life back to normal. Is it too soon?
It's really very scary to us now. We have so many Taiwanese students coming back from Europe and from the US because both places are closing down their university earlier. So it's really very big numbers of potential infected persons coming back. So we have set aside temporary hotels to put them in the hotel for 14 days. And this is a way before they can go into their homes, as just one panelist mentions before, the inside the house is very dangerous of the transmissions. And in terms of China, as I remind our panelists, you got to be very careful of any data from China. Their correctness, you have to doubt. So in Taiwan, we was wait and take serious look, and we also have some our informal channels from some of Taiwanese businessmen, and they always reported back from their ground observations some kind of phenomena they observe, which are not reported in academic papers or others. So we will wait. The situation is not as we thought so good. So just wait and see.
So the return to normal life as we knew it before the coronavirus pandemic is going to be a slow and very careful process. Let's talk a little bit about vaccine. Dr. Farley, we heard in the United States the first trials of the vaccine started in mid-February, towards the end of February, in fact, and by mid-March, Moderna, which is an American company, announced human trials. And we know that there are roughly at least 20 other companies and conglomerates that are trying to work on developing a vaccine. But still, we may not have a vaccine for at least a year to about a year and a half. Please help our viewers understand how a vaccine timeline works.
Certainly. Well, obviously, we need to have individuals who receive the vaccine and individuals who are negative for the virus to begin with. And in those types of trials, we use a placebo. So everyone will get a vaccine. Let me just be clear that I have not seen the protocol for this vaccine trial. But what we would normally do in a vaccine trial is someone will get a placebo vaccine and someone will get a real vaccine. And we follow those individuals forward in time. Now, in those vaccine trials, it is unethical not to teach every single vaccine participant how to protect themselves during that time. So we give both groups, whether it's placebo or the real vaccine, and investigators are blinded to that. We don't know. And then they move forward in time. And if individuals get exposed to the virus and then subsequently become infected with the virus, we will then be able to see, does the vaccine lead to greater protection versus not? If every participant in the trial follows the precautions we're recommending, hand washing, covering your cough, making sure you social distance, then we could see no infections in either arm of the study. And as a result of that, could be even further delayed, meaning you have to extend the trial to get the correct number of cases you need to determine whether or not the vaccine actually has efficacy, meaning does it work or not. So right now, the timeline is unprecedented. I applaud the National Institutes of Health and those agencies in partnership because it is an unprecedented timeline, and it is just an amazing, heroic level of effort.
Right. But even if a vaccine is ready, it's not necessary that all countries will have access to it. In fact, they may not be able to afford it. And also some countries that are developing vaccines and they produce vaccines, like India is a big pharmaceutical producer, they may not want to send the vaccine out in case of a situation like this. They may want to vaccinate their own people first. So in terms of availability and access, we could still have a lot of just loopholes. So Dr. Kamya Alay, you have dealt with the HIV epidemic in Iran. In terms of vaccine access, how important is it for countries to understand that they may still not have a vaccine and they need to come up with other ways of handling these kind of pandemics?
So it's very important because, as we know, the challenge of vaccine for HIV still is frustrating. And the point is that how much we have a continuous education for our target population, especially key population, that they are more vulnerable for HIV/AIDS. And this is very important. And the challenge we have is that because this is pandemic, people are freaking out. So they are seeking for any news and they don't verify who is talking about this news. For example, you talk about what kind of food we should use, or others, they may have misunderstanding. And this is the challenge we have. When there is an outbreak, we have to have immediate response and try to make sure to have very accurate and clear message to educate people. But this is the challenge we had, that each country used their own policies, and some of them they started very late, and some of them they tried to undermine that. And this is the situation that we have today. Definitely, as one of the panelists mentioned, it takes a long process, maybe up to 1 year to have vaccine. And given the treatments are not, they are effective, but they are not cure treatment. So the only remaining option people have is first self-awareness about the significance and increase to have a social distance, and also they try to quarantine themselves if they think they are at risk, or they may put their family members or friends at risk.
Dr. Chan, in terms of long-term lifestyle changes, what should be the new normal now? What should people and what should governments be focusing on? What have you learned from your experience?
Yeah, I think the social distance will become a new normal in the futures. The way people interact and the distance when we meet together as a group or between two persons will be changed, I think. And the other thing is hand washings. Until now, we think that hand hygiene is most important and has evidence-based good practice for prevention. So I will perceive as worldwide we have to create a more friendly environment for people who can wash hands in many public places. In Taiwan, after SARS, actually, we built a lot of public toilets, and the places for people to wash hands in park, in public transportation stops, train station, etc. I don't see that a lot in Europe, and probably after this epidemic, they should rethink to build some of these public health infrastructures. So I hope this will be a good sign of changing in the future.
And it sounds like such a simple and basic thing, washing your hands with soap. And yet the reality is that in so many countries, people simply don't have access to basic hygiene. They don't have access to soap. And hopefully now, after this pandemic, maybe we'll see more investments in basic hygiene, such as soap and clean toilets. Dr. Katz, when we talk about changes that governments can bring, should this push governments and public towards rethinking how we handle healthcare, how public healthcare is designed, the access, the affordability?
Absolutely. I think this is really a call to arms for governments to really reconceptualize access to healthcare, investment in healthcare systems, investment in solid public health infrastructure so that we don't have to face this again. I think this is the moment we need to seize on it.
All right. And Dr. Farley, in the short run, what should countries really be spending more money on? On quarantine facilities, on masks? What is it that a citizen should expect from their government at this point in time?
I think most importantly, we have to have clear, consistent messaging across the world. That's first and foremost. We all need to understand the threat we're under, and we need to be able to respond appropriately with the information we receive. But in terms of our own personal protections, we need to listen to our local epidemiology. Let that data be the guide on how much we need to, how draconian we need to be with our actual practices. When we think about what other features, we're hearing things from the U.S. government, such as new bills that are going to allow for covered paid time away from work. We're hearing covered testing. We're hearing expansion of the option for telemedicine-based services. So I think each local community, local government, both state and nationally, need to consider how to best support the populace. We've heard some great philanthropy occurring from business owners that are providing childcare to healthcare workers so that when their schools have closed, that the healthcare worker can still be available and move back and forth between work and family responsibilities. Those kind of efforts should be commended for sure. But I think that is a public-private partnership, and that will look different around the world.
All right. And Dr. Alay, in terms of countries that have a weak healthcare system, where do you see the biggest weakness, and what is a lesson learned from this current pandemic?
Sure. It's not only about the weakness of the healthcare system. For example, Iran has a very well-established healthcare system if you compare to the rest of the countries in the Middle East. It's about the attitude of policymakers that wants to be in early stage of diseases. For example, compare Iran with Afghanistan and Iraq. Afghanistan and Iraq, they have very weak healthcare system, but because the policymakers decided not to politicize the outbreak, they were able to manage this disease. And similar to the case of India, imagine with more than 1 billion population and the healthcare system is not great, but in early stage, they closed the borders and they had very proactive screening and they were able to manage up until today. So my point is more than the level of the healthcare system is the attitude of policymakers, how they want to approach this outbreak.
Mm-hmm. And Dr. Chan, lastly, if you can quickly answer this question, is it expensive to keep people healthy?
No, Taiwan has a single-payer systems, and we are doing a lot of preventions, and I think preventions cost much less than this treatment.
Right.
And
as they say, prevention is better than cure, and it seems prevention is also more affordable, less costly than cure. And at this point, I want to thank all of our guests because this wraps up our virtual town hall on coronavirus. I hope all our viewers feel a little less afraid and a little more knowledgeable about the coronavirus pandemic. I want to thank all our experts, Dr. Kamyar Alay, Dr. Ingrid Katz, Professor Jason Farley, and Dr. Chang Chuan Chan for their time. All right, and that wraps up our virtual town hall on coronavirus. I hope you feel a little less afraid and a little more knowledgeable about the coronavirus pandemic. I want to thank all our experts, Dr. Tom Frieden, Dr. Kamyar Alay, Dr. Ingrid Katz, Professor Jason Farley, and Dr. Chan Chuan Chan for their time. For more expert advice and guidelines, log on to cdc.gov or visit who.int. For news updates and safety tips regarding coronavirus, be sure to visit voanews.com and follow us on social media. Thank Thank you all for watching. From VOA's Washington studio, this is Sara Zaman. Stay safe, stay healthy.